exercises and stretches to correct the anterior pelvic tilt. We'll be following a clockwise sequence where we start by strengthening the abdominals, moving on to stretching the hip flexors, following it by strengthening the hamstrings and glutes, and finishing up with stretching the posterior muscles of your spine, especially the lower back. However, you do not need to follow any particular sequence and you can perform any of these exercises in any of the order. Demonstrating 4 different levels of progression to strengthen your abdominals and the core muscles, starting off with the bird dog exercise. The cue that I like to give here is using the analogy that get ready to be punched in the stomach. Imagine that someone is going to punch you in the stomach. So what you're going to do is you're going to try and create a defense by bracing your abdominals, really holding your core muscles really tight. What that's going to do is it's going to strengthen the outer six pack, which is the rectus abdominis, and also strengthen the transversus abdominals and the deep muscles of your spine. So these are the 4 different levels. And a quite challenging level is to perform the full plank with your legs raised. Moving on to stretching the hip flexors. Right now I'm demonstrating stretches for the left side of your hip flexors, where you get your right leg in between your palms. Again, as you move through these different variations, the intensity, the degree of stretch changes. So you may choose to perform any one variation suiting your body type, or you can start by gradually progressing with each of these stretches, with the easier, then intermediate, and then going into a full high lunge position for the maximum stretch in your hip flexors. The key thing here is to really force to contract the glute muscles to get the hip flexors to stretch to its maximum. Make sure that you're breathing normally as you hold any of these static positions. So the 4th level of progression, trying to sink your hip as deep as possible for a max stretch. Next is strengthening the hamstring and the glute muscles with a single leg bridge pose. For a very easier variation, you can do a regular bridge pose where you keep both your legs rooted on the floor and then gradually progress to a single leg bridge. Try to pull in the abdominals, lift your hips as high enough to maintain a neutral spine, holding the last rep for at least 10 to 15 seconds. Starting in Vajrasana, you're going to inhale, raise your arms up, and then exhale, you're going to move into Child's Pose. Where you try to make sure that the buttocks are completely rested on your heels and your forehead is touching the floor for a maximum stretch in your lower back and your whole spine. Cat stretch, to stretch the entire posterior muscles of your spine, right from your lower back all the way to the back of your neck. And this variation here is like an inverted child's pose, where you're lying on your back and hugging your knees to the chest. Corrective exercises and stretches for the posterior pelvic tilt, again following a clockwise sequence where we start off by stretching the abdominal muscle group, following by strengthening the hip flexors, moving on to stretching the upper hamstrings, and then finishing up by some strengthening exercises for the back of your spine, especially the spine extensors. Demonstrating the up dog here, where there is a deep back bend in the lumbar spine, and the next one is a cobra position where there is a deep back bend in the thoracic spine. Both postures excellent to stretch the entire abdominal wall. Moving on to strengthening the hip flexors, where you start by holding your legs at a 45-degree angle for about 20 seconds. Then moving on to some dynamic hip flexion exercises for about 10 reps. And then finishing up this movement by again holding your legs at 45 degrees, a static hold for another 20 seconds. This is a very easy variation to strengthen the hip flexors. This one right here, holding the chair seated position against a backrest, is quite challenging. It focuses on strengthening the rectus femoris, a large thigh muscle, which is also a hip flexor muscle. And this is the challenging variation, raising one leg. A simple seated one leg forward bend to stretch the back of your thigh, the hamstrings. Trying to keep the stretch as deep as possible, getting a nice good stretch with normal breathing. And finishing up with some hyperextensions to really strengthen the posterior spine extensors, especially the lower back. Try and lift your chest as high as possible, squeeze the entire posterior chain, doing a few dynamic repetitions in the beginning and finishing up by holding the last rep for at least 10 to 15 seconds with normal breathing. Do 2 to 3 sets of these. Hope